New tonight, we are learning more about an expansion to IMPD's Behavior Health Program. Details were laid out during a council committee meeting last night. CBS 4's Kelly Rinke shows us the success they are already seeing.
A lot of people see the police as there to arrest someone, take them to jail.
An arrest is sometimes not the most appropriate response to a 911 call. Sometimes police believe the person needs to stay out of the criminal justice system.
The end goal is that basically we get them back to being productive in their lives.
Officer David Kucha-Drain is a member of IMPD's Mobile Crisis Assistance Team, or MCAT. When a beat officer needs help assisting someone in a mental health crisis, he will respond to a call with a clinician. 96% of the time MCAT arrived on scene, no arrest was made.
The biggest need is probably medical services. We have a lot of people that have problems with getting their medications, maybe getting to the hospital.
The department's behavioral health services are a collaboration with Health and Hospital Corporation, which owns Eskenazi Hospital. During last night's Public Safety and Criminal Justice Committee meeting, the partners announced they plan to add 2 MCAT teams and bring on a dispatcher specifically trained in mental health.
People know there's less judgment. There's less diverting somebody to a location or to a program that's not going to be helpful to them.
Kimball Richardson is a licensed mental health counselor who helps train people working on these teams. IMPD's Behavioral Health Unit also works with MCAT. They follow up with people if police bring them to the hospital.
I mean, you're not going to be able to arrest your way out of that mental health crisis.
It's another way to serve and protect their community.
Let's get them linked up to the appropriate services that they need so they can get help.
In Indianapolis, I'm Kelly Rinke, CBS 4 News.
The Public Safety and Criminal Justice Committee also added an amendment to IMPD's budget. It requires reporting to the council, such as details of expenses and statistics on MCAT.